Hello, dear colleagues and dear friends. First of all, I would like to say thank you very much for the invitation to the organizer of Padua Myology Days, to Professor Ugo Carrara and his team. And I will represent the research study from our research institute. The reporter Elena Ivanova asked me to say because it's better to speak English. Okay, I will start the presentation. Can water exercise, gait, stereotypes, functional in patient with a neurological disease? Post-COVID syndrome symptoms: limited physical activity, decrease in exercise tolerance, shortness of breath, muscle weakness, joint pain, and tachycardia. This is data from Morgan 2020. A reduced exercise tolerance pathogenesis, disorders of microcirculation and tissue metabolism in the muscle tissue, and disorders of microcirculation in various brain structures responsible for automatic regulation of blood circulation in muscles, heart rate and respiration, analysis of proprioceptive efferentation, formation of subjective sensation of dyspnea. Effects of water exercises: facilities improve the intracranial, venous, and arterial blood flow. Compared to walking on land, walking in water reveals strain on the neck muscles comparative for the deviation of the vertical axis of the body during walking, which leads to less tension of the short extensors of the head and later muscles, reduced cervical lordosis, which naturally leads to improved blood circulation in the vertebral artery basin. Venous outflow through the jugular vein, improved intracranial blood circulation, and cerebrospinal fluid circulation dynamics. Improved the intracranial circulation, increased the resources of the parts of the brain responsible for the coordination of movement, positioning of the body in the space, and autonomic support of the muscular activity, making the neuromuscular activity to maintain the upright body position when walking more efficient. Training in water improved the central hemodynamics. Due to the Archimedean force acting on the lower half of the torso and lower limbs, there is less strain on the cardiovascular system, which makes it possible to exercise even for patients with a severe weakness, shortness of breath, and lower exercise tolerance. Improved microcirculation and metabolism of the muscle tissue, exposure to mineral water, increased cellular metabolism, microlymph flow, and microblood flow, which increase the functional reserves of skeletal muscles, including respiratory muscle, that lead increasing physical activity tolerance. What we use as materials and methods. An open prospective study was conducted of the efficacy of mineral water poor exercise in patients with a post-COVID syndrome. We take 29 patient men and women aged 18 till 70 who had suffered COVID-19 between 2 weeks and 3 months before the study and had symptoms of post-COVID syndrome, such as decreased exercise tolerance, breathlessness, weakness, and deviation of the center of gravity projection point, as measured by stabilimetry in the walking in place test. Exposure was the treatment consisted of a course of aqua training in the freshwater pool for half hour, 10 session, pool water temperature about 30-32 Celsius. Methods include common step walking in water for 10 minutes, walking with a knee raised high for 5 minutes, walking with support, swimming board for 5 minutes, walking with resistance, swimming board for 5 minutes, and walking with a special handhold variant involving upper limbs and body muscles. Outcome control. A control study was conducted on the first day before the exposure and on the 10 days after the end of the 10 days treatment course. A stabiliometric study test was performed in the walking in place using the multifunctional medical complex HADELECT. This is a very good equipment based on high precision non-contact sensor Microsoft Kinect. Here you can see deflection of the projection point of the center of gravity in the walking in place test before and after water exercise. On this screen, you can see Hertz deviation in the walking in place test before and after water exercise. This is a dynamic of oxidative metabolic rate before and after treatment. A summary of the study that water exercise in a freshwater pool helps. Correction of impaired upright posture statistically, a reduction of the reduction of the amplitude of head and neck movements when walking, and increase in oxidative metabolism. So the conclusion of the study that this method can be useful supplement to traditional rehabilitation programs for patients with a post-COVID syndrome. Thank you very much for your attention.